impressive result indeed. And last, we're going to go to Buenos Aires in Argentina, plastic surgeon, Dr. Fabian Perez Rivera, who is with us live. So we are going to see his case and then we're going to talk.
Hello, everyone. I am Dr. Fabian Perez Rivera from Buenos Aires, Argentina. I am plastic surgeon, and I'm going to talk about a case of facial acne sequelae scar treated by CO2 fractional laser. First, to remind you that the CO2 laser works at 10,600 nanometers. That's why obtain a complete absorption in water, in the skin water. Know that we need to mention that when we think about CO2 laser, we have two actions on mind, or coagulation or ablation, or a combination of both of them. In my device, I can choose the low parameter. Each one have a lot of coagulation effect and really low ablation effect. In the high parameter, I have the opposite, a lot of ablation effect and really low coagulation effect. And in the middle, we have the medium parameter with a combination of both actions. Here it is, the resurfacing handpiece in action in the surface of this patient, and you can see the dots will leave on the skin. This dot was created by the laser beam go through a pixel beam splitter, and then when it's divided, go to the focus lens, and it's allowed to give 81 microbeams to the surface of the skin. And why this is important? Because we obtain the goal of this treatment. Always leave untreated skin. Always look for a complete wound healing restoration. It means that between each dot, between each column of heat, we leave untreated skin. And this gives us the possibility to a complete wound healing restoration, as you can see here in the drawing. Here is the past, the classical CO2 laser, in which one erase all the surface of the skin, and this one, the actual CO2 laser, the fractional ones, which one obtain always in untreated skin between each dots. And this goal give us the possibility to pass several times over the skin without any risk. If we pass only one time, we obtain 80% of untreated skin. That's why it's really safe. But even if we pass 4 times on the surface of the skin, we still have close to 59% of untreated skin. And in this way, we can avoid, for example, scars. The classical indication for CO2 fractional laser are facial resurfacing, acne sequelae scar treatment, and the removal of epidermal lesions like keratosis, warts, and nevus. We want to talk about acne sequelae scar treatment. This is our patient, female, 20 years old, only perform peelings and creams like previous treatment. With the diagnosis of severe unilateral acne sequelae scars, I performed on her face 2 sessions, the first one on May 2015 and the other one in August 2015. We used the high pixel CO2 fractional laser, and we used the same parameters on both sessions, the parameters I show you in a minute. When I talk about characteristics, I want to mention that, of course, this is a painful treatment. And that's why we need to add anesthetic cream with lidocaine 10%, tetracaine 10%, cold air at 4 grades of centigrade, injectable anesthetic at lidocaine 2%. We use the handpiece nape per 9 dot. Nape per 9 dots. We obtain 81 dots with the low action in 120 millijoules and medium action in 120 millijoules. Remind you that the low action obtain coagulations and the middle action obtain a combination of coagulation plus ablation. We pass 4 passes over the surface of my patients and the skin, 2 with each parameter. And at the end of the treatment, we add cold gel pack and moistening. This is the result of my patients before and after 3 months of the second sessions. This is a profile view, no makeup on the skin. I'm going to give you the possibility to show a closer view, and I take out the color of the skin to give you the possibility of a better measure of the result. And you can see here the complete reduction of a lot of this scar on the surface of the skin. Another profile, again, I choose a little part of the face of my patient, a closer view, and again, I take out the color of the skin, the color of the photo, and you can measure better the reduce of dots, reduce of scar in the skin of a patient. This is the present patient testimony on May 2021, a few weeks ago, and at this moment she has 26 years old. The testimony is in Spanish. I translate for you.
Hola, mi nombre es Lucía, soy paciente del doctor Fabián Rivera, con el que realicé el tratamiento de láser CO fraccionado, las cuales tuvieron 2 aplicaciones en mi caso. La realidad es que ambas aplicaciones tuvieron un nivel muy alto de dolor y, sin embargo, aún sabiendo esto, volvería a hacer este tratamiento sin duda alguna, porque los resultados superaron en creces mis expectativas. Yo tenía marcas y manchas de acné muy severas y la realidad es que es algo que interfería en mi día a día, en mi cotidianidad, y luego de este tratamiento pude reconstruir mi autoestima y seguridad y ayudó muchísimo a mi desarrollo personal. Así que de la escala del 1 al 10, la verdad que un 10 absoluto de este tratamiento, porque me devolvió mi cara, básicamente. Estoy muy feliz con los resultados.
Well, only to know that it's a self video. The image is like a mirror. That's why this left side is in fact this right side is the left side of my patient. The side was treated, and of course the patient don't have any kind of makeup. When we talk about post-treatment characteristics, it's important to mention that of course we obtain scabs over the surface of the skin, swelling and edema, usually for a week, in this case for a week, redness for 2 weeks, and in this case we obtain as a side effect a PIH, a post-inflammatory hyperpigmentation after the second session, and keep on the skin for a period of 3 months. And we treated with hydroquinone 2% plus kojic acid 2% in cream. And of course, we give the advice to our patient to use sunblock and avoid sun exposure for at least 6 months, and moisturizer cream all this period. I hope you enjoy my treatment. Thank you for attention.
Thank you very much, Dr. Perez. We have 3 questions. One to Dr. Xiang Jen. Actually, this is my question. This is from Maurice Adato. Myself, I didn't understand where he takes the graft, the dermal graft. So I'm not sure he really explained it. So we are going to email him this question, and we're going to get back with an answer, because the results are quite impressive. But the question is, how does he manipulate the skin to have this dermal graft? So this question will be answered because he's not with us live. The second one, there are 2 questions to Dr. Perez. One, regarding the interval. So how often, Fabian, do you do your treatment? And there is another question: do you combine other modalities with, because you performed only fractional CO2 laser? Do you combine any? Probably the question was about combination, so I have to figure out, but probably any prosthesia, subcision, fillers. So do you combine any modalities with the fractional ablative CO2 laser?
Okay, thank you. Thank you so much for the question. Well, for the first question, I'm aggressive, as you see here in the screen. I use 120 millijoules. That's why I often obtain a prolonged PIH, but it's no matter for me. I know that it's going to happen. That's why I wait at least 3 months in between each sessions. As you can see on the screen, and the result of my patient is good enough to resolve a great amount of the scars in the patients. Yes, in some cases when we have the box, the scar-like box, I add fillers or fat graft too, but I need to have one really important and big size scar, because for the majority of my patient with little, few and little scars, is better with the CO2, of course. Actually, on my practice, my private practice, I combine in some cases CO2, that the first line of my choose, but by the PIH and by the pain during the procedure that the patient suffer, in some cases, the second session or the third session, I combine microneedle radiofrequency or picoseconds with dual focus dot to obtain not the same result, but with really few side effects like the CO2.
So not at the same session. So you perform fractional ablative CO2 laser, and then after 2 months, you perform different devices or different technologies.
Yes, yes.
Or because
I try to don't combine in the same session, because on my hands it's going to be really aggressive. I am aggressive with CO2. If I add other kind of treatment, I think it's going to be really great aggressive. But as I tell you a few seconds ago, in some cases on my hand CO2 is the best, but I try to combine because the post treatment care is in some cases is really tough for my patients.
So we're going to wrap up, and I'm going to invite you, Dr. Perez, because I think it's going to be on the third day. There is a session on acne scars, and we have just finished. It's going to be a consensus of 30 physicians from around the world of this combined approach for the treatment of scars. It followed the Delphi questionnaire technique, and it took us 3 years to collect all data and all methods. And actually, one of the physicians from my group, he summarized and he's going to present. And it's very interesting how different physicians treat acne scars worldwide, and how they combine between different modalities, same session or in different sessions. So it's just a promo. So we're going to finish. Thank you very much for attending. And I will thank all speakers for this amazing results and amazing cases. And we're going to conclude the day. This was just the first day. Tomorrow is going to be loaded with information and with the sessions, important sessions on keloids and laser-assisted drug delivery. And this is just the beginning of the day. So have a great, great evening, and we will see you all tomorrow. Bye-bye.
Thank you. Thank you so much. Thank you for the advice.